It partly depends on whether you accept a kind of medical definition, in which case psychopathology is the presence of a list of symptoms like depression or anxiety or obsessive-compulsive features, things like that. But that's a rather narrow definition. There's a bias in the mainstream of psychology and biological psychiatry that wants to see something like depression as a biochemical disorder of the brain, as if that was primary, whereas the more depth psychologically oriented practitioners would see depression as a reaction to a life circumstance, and the brain chemistry is secondary to the psychological process. So the brain chemistry is how you get depressed. The reason why you get depressed is something that's going on in your life. There's a big difference between how and why, and I think that the mainstream tends to confuse the how and the why. And then I wanted to talk a little bit about Jung's notion that symptoms have a purpose. They're not just dependent on issues that happened in childhood and in development, but that somehow a symptom can be trying to move the personality in a particular direction. This is what's called sometimes the finalistic or synthetic view of symptoms, that they have a purpose. I thought I'd talk about the Jungian view of psychosis, because it's quite different than the mainstream view of psychosis. Especially I'm thinking of schizophrenia. The mainstream view, of course, is that it's a disorder of the chemistry of the brain. There's some wonderful Jungian literature talking about how these problems are a kind of eruption of the mythopoetic level of the psyche into consciousness, and that these what look like illnesses are actually attempts at self-healing. We all have a little bit of this kind of material in us. We can all be a little bit obsessional, a little bit paranoid, and depressed, and maybe even a little bit psychopathic, and so on. So it will help us. So what we call a disorder is simply an extreme version of that, but we all have these traits in us. So I'm hoping that the material will help people understand themselves a bit better. And of course, the people that we're related to will see these traits in others. So I'm hoping it will help people understand the people around them as well.